I think one of the greatest advances, one of the most exciting things that I've seen with knee replacements is our ability now to perform partial knee replacements predictably. Many people come in to see me and they have a misconception. They think that if we talk about replacing a knee, we're going to literally cut out their knee and put in an artificial one. What we're really doing is just reshaping the ends of the bones and resurfacing the ends of the bones. But the real art that makes it predictable and gives someone a perfect result, one that really lets them get back to activities and play tennis and do things, is when not only you resurface the bones so the bones aren't touching and realign the bones so the alignment and the weight bearing is equal, the mechanical axis is restored, but you balance the soft tissues throughout the range of motion, and that's really the art. So one of the things that's evolved, one of the things that's made this much more predictable has been our ability now to use computers to help realign and rebalance the joints, both for total knees, which is when we replace the entire bottom of the femur bone, the entire top of the tibia bone, and the underneath surface of the patella or the kneecap. And indeed, it's a gold standard and it helps people. But imagine someone who only has part of the knee which is worn out, and they have a deformity, but it's easily correctable. And the other parts of the knee are not worn out. If you don't have to replace the whole knee, if you can only replace one or maybe two of the compartments, then you don't injure, you don't involve the uninjured compartment. There's a lot less surgery. And you don't remove the normal cruciate ligaments, and you don't interrupt a lot of the normal neurologic pathways that take information to our brains. So people invariably prefer their partial knees in big studies over total knees because they feel normal. When we think of how a knee moves, we think of the kinematics of a knee, and just the layperson would say, well, gosh, it's just a fancy hinge that extends and flexes, but actually it's a lot more interesting and a lot more complicated, because not only does it extend and flex, as it does that, it twists and it opens. So it's called a pivot. Imagine when you flex your knee, the back of the femur bone actually falls off the back of the tibia bone. And when you extend the knee, it goes back up. So there's a pivoting motion. So those are normal kinematics, normal movements. And the best results is when you can perfectly recreate normal kinematics. We're so fortunate here at Holy Cross that we have not only computer navigation, we have a robotic system which allows us to virtually balance and create the whole operation before we ever go in the operating room, and then fine-tune it and execute it. So because of that, I do far more partial knee replacements than I used to, because patients do so well.